there's a whole set of beliefs that you can't have a deep recovery when you're on buprenorphine, and I don't know what to say about that. You don't have a deep recovery if you're dead. Buprenorphine treatment saves lives, is highly effective, reduces illicit drug use, people who are maintained on buprenorphine for a year have 75+% abstaining from illicit drug use, and people who don't have closer to zero, along with a bunch of deaths. But I think, there's ignorance and stigma, and there's ignorance about the fact that Suboxone should be prescribed, buprenorphine should be prescribed, at the dose which is correct for the patient, where their use, cravings and withdrawal are blocked, and where they're comfortable, and it should be, and there's no deadline on how long it should be maintained for. A lot of physicians still work from a place where they wrongly, think that it should be on a low dose for a short amount of period of time. There are people who I won't prescribe buprenorphine for. There are nuances of who I deem might be able to avoid being marinated in an opiate for a long period of time. Those are the ones who aren't truly opiate dependent, right? If they're sort of on the edge, and I think, great, let's see what we can do. Because sure, when you commit someone to buprenorphine, you're marinating them in the opiates. If they weren't opiate dependent beforehand, they will be by the time you're done with them. So it's not something to give to everybody, just like you don't give every borderline diabetic insulin when they walk in